best test for both screening and diagnosis is a colonoscopy. There are other techniques, but these screening tests are not as accurate as a colonoscopy. And when they do identify an abnormality, a colonoscopy is still required to make the real diagnosis.
So are you ready for your colonoscopy next week?
No, not at all.
You sound a little bit apprehensive.
A lot.
A lot?
Yeah.
Well, it's normal to be a little bit scared of this, but there's really nothing to it. It's really easy. Let me explain it to you. The day before, you're going to take some preparation to cleanse your colon out. I'll meet you at the surgery center. An anesthesiologist will put an IV in your arm, give you some medication, and you'll go off to sleep.
So I'll be asleep during this whole procedure?
You will be asleep during the whole procedure.
And no pain?
No pain. And I'll perform the colonoscopy. While I'm there, if I see anything abnormal or polyps, growths, inflammation, I'll biopsy or take them out. After you wake up, you'll be in the recovery room, and that's all you'll remember.
It's not going to hurt at all afterwards, or?
It doesn't hurt after, and it doesn't hurt during because you get the medication. Afterwards, you can go about your daily routine.
So I can go back to work the next day?
You can go back to work the next day. You might be a little tired the day of the actual colonoscopy, and you will need somebody to drive you home. We'll get you through it.
Colonoscopy is safe and convenient. After taking a laxative and cleaning the bowel, a patient is given a mild intravenous sedative, and once they are fully relaxed, a colonoscope is gently inserted into the rectum and advanced through the entire bowel. The doctor is then able to examine the entire bowel through a special eyepiece. If there is a polyp, often this can be removed through the colonoscope. After the procedure, patients need to have somebody help drive them home, as it takes several hours to fully recover from the anesthesia. There seems to be a lot more ladies who are being diagnosed with colon cancer.
We've had 2 35-year-old women in our practice right now diagnosed with pretty late stage colon cancer.
It used to be that it was thought to be a man's disease. Women would say, well, that's something that occurs in a man. I says, no, prostate cancer occurs in men, you know. And so I think education has helped us a lot.
So women seem like they really ought to be at the forefront. I mean, they're getting their annual mammograms, they're getting their pap smears, and now they should be getting their colonoscopies.
They should. It's the #2 cancer in women.
Yeah.
And I had one young lady who came in a little bit hesitant to do her colonoscopy. She went ahead with the procedure. She found a small cancer in the bowel wall that was easily cured with a simple resection and just a couple-day hospital stay. So I think if we do a good job of educating the patients, we can help overcome that anxiety. But I think a big key of doing early colonoscopy and preventive colonoscopy is you catch the cancer at such an early stage that you don't really have to proceed to chemotherapy. There's, I think, better than a 90% cure rate if colon cancer is caught early or even prevented.
Actually, yes, it's considered one of the cancers that can be prevented. And I think what you said earlier about the patients that had precancerous lesions found, and that's the ideal patient that we do colonoscopy on. Most patients think that when they do have colonoscopy that if we find something, they're focused on us finding cancer. But the more common situation is we find polyps and remove them and prevent the patients from going on to surgery.
Amy, James, good to see you. Thanks for coming in today. I got the report back on the colonoscopy from Dr. Browder. Nothing to worry about.
Oh, that's good.
Did you feel okay the day after the test?
Yeah, it was fine, just like they said.
Super. She found 2 small polyps, perfectly benign, no sign of cancer. She recommends you have the test repeated in about 5 years.
That's great.
He had the procedure, and luckily he just had benign polyps. I consider that a big success story. The lifetime risk of having a significant lesion that can be found with colonoscopy, even for an asymptomatic patient with no family history, is somewhere around 1 in 20. And if a family history is present, I think that risk jumps up to maybe 1 in 10.
And there are some other types of colon cancer that have a family inheritance pattern, and those we like to try and identify also, but I think you're perfectly correct in the numbers you've cited.
And I think that patients need to remember is that this is silent. There's no symptoms. And so oftentimes they won't come, if they come to us with symptoms, they're advanced already.
Some of the symptoms of colon and rectal cancer are, number 1, bleeding from the rectum, either bright red blood or dark stools. Number 2, narrow stools, They often talk about being pencil thin and people have difficulty passing the stool. Number 3, significant fatigue that is often a symptom of anemia. Number 4, a feeling of incomplete emptying of the rectum after a bowel movement. Number 5, any significant change in the bowel habits such as new constipation or diarrhea. Number 6, unexplained weight loss is also a worrisome sign. However, it's important to realize that early stage colon and rectal cancer often do not have any signs or symptoms, which makes routine screening so much more important in early detection. The easiest way to treat an early colon or rectal cancer is actually through a colonoscope. A snare or loop is often the best way to remove small polyps, and this has very few complications and virtually no need for hospitalization.
Patients that present with colon cancer, that we find colon cancers, right now 65% of those colon cancers are advanced. So if now we're going to have a population become scared to get colonoscopies and the screening tests, what will that number jump to?
There's a lot of confusion out there. And when someone is facing the possibility of cancer, it can be a bewildering forest of information and testing. You are not alone. The Cancer Care Foundation will serve as a patient advocate, your guide on the side. There are a host of ever-changing and confusing treatment options and millions of websites and discussion groups and publications, enough to boggle the mind. The Foundation is here to help by pointing you in the right direction. Our motto is celebrating life, your life, and the millions of others who are considering the option of screening, and the millions of people currently involved in their cancer journey. For more information, please call or visit our website.